The presentation today will be in four parts. So I'm going to give a very broad overview to the area. Then Kathy's going to talk about a few specific studies that have been done around components of plant foods that we think are quite important for heart health. And then Kevin's going to talk a little bit more about some of the mechanisms that might be involved in the protection of some of those components. And then I'm going to come back at the end and talk about a new study that we're really excited about, which is just about to start out of the MRF. So about 400 BC, Hippocrates said our food should be our medicine and our medicine should be our food. And for much of human history, food and food components or food extracts were medicine. And it's really only in the last century or so where there's been huge advances in pharmacological treatment, so drug treatment, surgery, and also public health approaches to prevent not only chronic diseases but also infectious diseases. However, food is still as important and perhaps more important than it has been through time, particularly with people living longer. So this was an article that was in The Lancet, which is one of the premier medical journals, earlier this year, and it indicated that poor diet is responsible for more deaths globally than tobacco, high blood pressure, or any other health risk, and that consuming low amounts of healthy foods such as fruits, vegetables, whole grains, seeds and nuts, and too much unhealthy food, including sugar-sweetened beverages, account for 1 in 5 deaths globally. So very important. So what are the major causes of death globally? Well, the top 2 causes of death globally are coronary artery disease or heart disease, heart attacks, and strokes. And if we have a look at the global causes of death, we can see that cardiovascular diseases, heart disease and strokes, accounts for about 31% of all deaths globally. And I guess the good news here is that cardiovascular disease is a lifestyle-related disease, strongly related to diet, and is preventable. And it's estimated that up to 80% of cardiovascular disease could be prevented through changes in lifestyle. There are a number of other chronic diseases which also have strong lifestyle components, a lot of the cancers, respiratory diseases, diabetes, and other non-communicable diseases. And all of these have a strong dietary component to their development and to their prevention. So what are the key lifestyle factors for prevention of chronic disease? I guess most of you will know what most of these are. They are eat a healthy diet, be physically active, don't smoke, limit alcohol consumption, and sleep well. So the messages are quite simple. Often not so easy to follow though. Australia's dietary guidelines are, a number of them are designed to prevent chronic diseases like cardiovascular disease. And this one of the guidelines encourages us all to enjoy a wide variety of nutritious foods from the 5 food groups every day. It encourages increased intake of vegetables, particularly vegetables different types, different colours, because they contain different components which are contributing to our health. Same with fruit. Increased intake of cereal grains, mostly whole grain cereals, nuts and seeds, legumes, things like chickpeas, lentils, beans, lean meats, including fish, reduced fat dairy, milk, yogurt, cheese, or their alternatives. And the guidelines also encourage drinking plenty of water. And if we have a look at how this guideline is translated into an image, this is the Australian Guide to Healthy Eating. And on this image, you can visualise this as a plate. So this is gives an idea of what you should be consuming on your plate. So you can see that most of these foods are plant-based. So you get your fruits, vegetables, your cereal grains, other grains here, legumes, and alternatives, small amounts of fish and lean meats, and small amounts of dairy, and even smaller amounts of these discretionary foods. And if we have a look from around the world, different populations have been studied in relation to dietary patterns that are strongly linked with disease prevention, and they have things in common. All of these dietary patterns have in common higher intakes of fruits, higher intakes of vegetables, and higher intakes of other plant foods like cereals, grains, seeds, and nuts. So again, the messages are simple. It may not be so easy to follow. So a lot of our work is in the area of looking at the health benefits of fruits and vegetables, and the guidelines or the recommendations at the moment are that we should be eating at least 2 serves of fruit and 5 serves of vegetables every day. And a serve of fruit is about 1 apple, or 150 grams, 1 banana or one orange. And a serve of vegetables is about half a cup of cooked vegetables, or 75 grams, or about 1 cup of chopped raw vegetables. And there's now a huge amount of evidence around that kind of level of intake as providing most of the health benefits of fruits and vegetables. It's not to say you won't get further benefits beyond that, but the benefits are much smaller beyond that kind of level of intake. Despite all of this evidence, only about 1 in 20 Australians meet these recommendations. So how do fruits and vegetables protect against cardiovascular disease and other chronic diseases? Well, up until about 20 or 30 years ago, it was thought it was because they were nutrient dense. That is, that they were rich in things like dietary fibre, vitamins such as provitamin A or beta-carotene, other folate, other B group vitamins, vitamin C, minerals, potassium, calcium, magnesium, iron, and other trace minerals. And that probably is an important factor as to why these foods are protective against chronic disease. However, in the last couple of decades, there's been increased interest in other components of these foods that are likely to be protective against chronic disease, and particularly cardiovascular disease. And these are known as phytochemicals or plant chemicals. And the interest in these is in relation to the bioactive or biologically active phytochemicals. And 2 of these that we're particularly interested in are the flavonoids, which have traditionally been termed antioxidants, and they're in things like fruits, various fruits, and nitrate, which is in different types of vegetables. And I'm going to pass over now to Kathy, who will talk about some of the studies that we've done in this area looking at flavonoids and nitrate and their potential health benefits.
So cardiovascular disease is still the leading cause of death worldwide. And the sad fact is that a large number of these deaths are preventable. And why are they preventable? Because the majority of risk factors for cardiovascular disease can be avoided. Now, 9 out of 10 people have at least one risk factor for cardiovascular disease. So we need new strategies to avoid the development of these risk factors, or for those who already have a risk factor, to halt the progression into cardiovascular disease. So there is now strong evidence that a fruit and vegetable-rich diet is very protective. But what are the components responsible for this, and how do they work? Well, there are probably quite a few number of protective components, but as Jonathan mentioned, there are 2 that we're particularly interested in, and these are the flavonoids and nitrate. So I'm going to take you through our research into flavonoids and nitrate and the studies that we have conducted. So first of all, flavonoids. So flavonoids are found widely in our diet. A number of sources of flavonoids, including green tea, black tea, grapes, berries, orange juice, soy products, onions, green leafy vegetables, chocolates, coffee, and one of the sources of flavonoids that we are particularly interested in is apples. So I'm going to present some research to show you that actually an apple a day will keep the doctor away. So apples are rich in flavonoids, and these flavonoids are concentrated in the skin of apples. We recently had a look in 1,400 Perth women over the age of 70 and followed for 15 years. And what we observed was that there was a 20% lower risk of dying from any cause with at least half an apple per day intake, and a 35% lower risk of dying from any cause with at least one apple a day intake. So there are 3 flavonoids in apples where there's evidence from other research that they have heart health benefits. So what we wanted to do was assess the effect of apples rich in these flavonoids on blood vessel health in healthy men and women. So we conducted a randomized controlled crossover clinical trial at the Research Foundation. And now this is the gold standard in research evidence. And why is that so? And that's because volunteers act as their own control. So in this study, they were randomized to have either a high flavonoid active first, so this is apple and skin, or a low flavonoid control first, which was apple flesh only. So I mentioned earlier that flavonoids are concentrated in the skin of apple. And if they had the high flavonoid active first, they would then had the low flavonoid control in the subsequent visit. And if they had the low flavonoid control, they had a high flavonoid active in the subsequent visit. And the apples we used in this study were Pink Lady apples. So our volunteers came into the Research Foundation and we did a whole lot of baseline measurements. We then gave them their apple treatment, and within a few hours of intake we then repeated the measurements to assess change. Now, one of the measurements that we do is a measurement called flow-mediated dilatation. So what this does is it measures the dilation of an artery. So the more an artery dilates, the healthier it is. And we get our volunteers to lie down on a bed, and we put a blood pressure cuff around their arm and an ultrasound probe over their brachial artery, which is the long artery that runs down the arm. We get a picture of that artery, which is that solid black line there. We increase pressure in the cuff for 5 minutes, which slows down blood flow through the artery. When we release the cuff, you get an increase of blood flow through the artery, which dilates in response, and we measure that dilation. So what we saw was that at every 30-second time interval after the cuff was deflated, we saw an increase in the dilation of the artery with the apple and skin compared to the control. So this was within a few hours of intake. So we saw a beneficial effect within a few hours in healthy people. So we then wanted to go on and assess the effect of apples rich in flavonoids on blood vessel health with both short-term and 4-week consumption in men and women with at least one risk factor for cardiovascular disease. So we had 30 non-smoking men and women, and they had either slightly elevated blood pressure, high blood sugar, high cholesterol, and or central obesity. So they came into the RPH Research Foundation for a screening and learning visit. They then had 2 weeks of a low flavonoid diet where we asked them to avoid high flavonoid foods like tea, red wine, chocolate, and onions. They then, when they came in, we did some baseline measurements. We gave them apple or the control to eat, and then a few hours later repeated the measurements. They then went away and had their apple or the control for 4 weeks. They came back in and we repeated the measurements. Then there was a 2-week washout period, which was low flavonoid intake again, and then they went on to the other arm of the study. So if they had the apple treatment in the first week, they crossed over to control and vice versa. So again, in this study, the apple treatment was apple and skin, and the control was apple flesh only. This just shows that with the apple flesh and skin compared to the apple flesh, it was a lot higher in the flavonoids that we are interested in. So we performed flow-mediated dilatation again, and what we saw was within 2 hours of intake in these men and women with at least one risk factor for cardiovascular disease, an increase in the dilation of the blood vessel at every time point measured with the apple flesh and skin compared to flesh only. And we saw a similar effect after 4 weeks of intake. So we are very interested in the flavonoid content of Australian apples, and we are working with the WA breeding program here in Manjimup. And we have measured the flavonoid content of over 100 different varieties that they have bred. And this shows just some of the results that we have observed. So the first one is the Bravo apple, which has recently been released onto the market, and that has one of the highest flavonoid contents. There's also Pink Lady, which is very high, Gala, Golden Delicious, Lady Williams, and Fuji.
So it doesn't correlate with the colour of the skin?
Not necessarily, no.
Oh, that's a bit tricky.
So we are doing research into the health benefits of Bravo apples currently.
And that's all been developed in WA, that apple? Yay!
Yes. Go WA. So we know now from our previous studies that I presented that there is a benefit of having flavonoids in the short term, so within a few hours or 4 weeks. But what about long-term intake with long-term health outcomes? So I'm talking like dying from all causes, cardiovascular mortality or cancer. So we recently investigated this in over 56,000 Danish men and women. And what we saw was there was a decrease in all-cause mortality with higher flavonoid intake. And the steepest part of the curve was up to about 300 to 4 milligrams of flavonoid intake per day. And interestingly, not much added benefit the higher you went. And we saw similar effects with cardiovascular disease-related mortality and cancer-related mortality. So what does this 300 to 400 milligrams per day flavonoid intake look like? So if you have a look at your recommended 2 fruit serves a day and 5 serves of vegetables a day, if you had 2 serves of fruit with 2 different types of fruit, it doesn't matter which ones, and if you had your 5 serves of vegetables daily, you would achieve that 300 to 400 milligrams of flavonoid intake per day. And that's not taking into account other rich sources of flavonoids such as a cup of tea. So the other compound I wanted to talk to you about was nitrate. Now nitrate is found in high concentrations in green leafy vegetables and beetroot. And when we ingest it, it's absorbed into the bloodstream, and there is this active uptake of nitrate into the saliva, which is converted into another molecule in the mouth by bacteria on the tongue. We then swallow this, and then this gets absorbed into the bloodstream, where it becomes another important molecule called nitric oxide. And nitric oxide is vital for our blood vessel health. So we and others have shown that nitrate from vegetables through this pathway has a number of beneficial effects on blood vessel health. So I'm going to present some of our research. So the very first study that we did was to assess the effect of spinach, rich in nitrate, on blood vessel health and blood pressure in healthy men and women. So again, we conducted a randomized controlled crossover trial at the Research Foundation, and our volunteers came in. We did a whole lot of baseline measurements, and then in random order, they had high nitrate active, which was a bowl of spinach rich in nitrate, or the control was just a glass of energy-matched rice milk. We measured their systolic blood pressure, and within an hour and a half, we saw a significant reduction in systolic blood pressure with the nitrate from spinach compared to the control. So we've done a number of studies now looking at vegetable, nitrate-rich vegetables and effects on vascular health with positive effects seen. So again, we wanted to ask the question, so we see a benefit short-term, what happens with long-term intake and your serious health outcomes? So we answered this question in 1,400 Perth women who were followed for 15 years. And the main sources of nitrate for them were lettuce, spinach, celery, and beetroot. And what we observed was that nitrate from vegetables lowered the risk of having a stroke or dying from stroke by 40%. And this effect was seen with just over 50 milligrams per day nitrate. We also saw that nitrate from vegetables intake lowered your risk of dying from heart disease by 42%, and this was also roughly, again, 50 milligrams per day nitrate. So what does this 50 milligrams per day vegetable nitrate look like? So if we have another look at your 2 serves of fruit and 5 serves of vegetables, if in your 5 serves of vegetables you made sure that one of those serves was half a cup of cooked or 1 cup of raw green leafy vegetables, such as bok choy, lettuce, kale, spinach, beetroot, you would be achieving this 50 milligrams per day of vegetable nitrate. Thank you.
Well, what I wanted to talk to you about today in the next 5 or 10 minutes is about the chemistry of plants and these phytochemicals that were referred to earlier. I actually did my initial research training on plant chemistry, so although I'm now working in medical research, I feel that's been a really good background for me. So many of the foods we eat contain what we call phytochemicals, and you'll be familiar with lots of them because things like carotenes, which are in tomatoes and carrots, give them that lovely red and orange colour. We'll be familiar with compounds called alkaloids, which are nitrogen-containing compounds, and probably the best known of which would be caffeine, which is in tea and coffee, for example. And then sulfur-containing compounds in things like the broccoli, the brassicas, and garlic and onions. These are interesting sulfur compounds that sometimes make your eyes water, but are also thought to have health benefits. But the group of compounds that we're mostly interested in, which are called the polyphenols as a whole group, or in particular flavonoids, have this sort of chemical structure here. And they're found in tea, citrus, berries, onions and apples, for example, and other things as well, coffee. So I'm going to talk a little bit about these. Some of the myths surrounding phytochemicals, and I think Lynn talked earlier about food fads. You know, about 10 or 20 years ago was about antioxidants, and you know, antioxidants are really important, and they are important, which I'll talk about in a moment. And that they're important because free radicals are bad. And I'll tell you what free radicals are in a moment. If we have lots of antioxidant supplements, we can prevent disease, and I think that's not necessarily a true statement. And there were some big trials using vitamin E for heart disease that were unsuccessful, I think because we had the wrong idea about what these compounds did. So dietary flavonoids and cardiovascular disease, I prefer to use the term bioactives now rather than antioxidants, because the evidence that these compounds act as antioxidants, direct antioxidants in the body, is not there. They probably don't. And the reasons is they're actually in very low concentrations in the bloodstream. You know, we have much, much more vitamin E and vitamin C than we have of these flavonoids. They undergo metabolic transformation. In other words, the tissues and the bacteria in our gut metabolize these compounds to a whole lot of different metabolites, which are not necessarily going to be antioxidants. So what they are involved in is they target specific pathways in the body, and this is capable of taking place even at the very low concentrations that these are in the circulation. And we're now starting to understand what some of these key targets are. So let's talk a little bit about free radicals. And I think one of the myths is that free radicals are bad, which is actually not really true, because they're part of our normal metabolic process. So a free radical is just an atom or a molecule that has an unpaired electron. And when an atom or a molecule's got an unpaired electron, it tries to grab one from somewhere else. And then that will damage that other molecule or electron. But if you have an antioxidant that might have a spare electron, it can donate that to the free radical and everybody's happy. Free radicals become harmful if they're formed in excessive amounts. And this might be in the case of infection or inflammation, extreme exercise or tissue damage, or if we're exposed to external sources like radiation, cigarette smoke, or certain toxins, then we might have more free radicals than the body can handle. But actually, free radicals are a normal part of physiology. And I think Kathy mentioned nitric oxide. So nitric oxide, which is essential for our normal blood vessel function, is a free radical. Our white cells generate free radicals such as superoxide to destroy invading microbes. So, and nitric oxide, as I mentioned, is important in blood vessel function and in neurotransmission. And there's evidence that some free radicals may carry messages within the cells. So free radicals at a controlled level are actually very beneficial for us. So where they're bad is when they're in excessive amounts and they damage cell membrane or the contents of cells. For example, if you damage the proteins that carry cholesterol in the blood, that may help to develop atherosclerosis or heart disease. Damage to DNA in some cases may lead to certain cancers. Damage to proteins can affect the structure and function of that protein. For example, damage to proteins of the eye might lead to cataracts due to too much UV irradiation. So antioxidants are part of our body's protection against too many free radicals or oxidants. And they're generally substances which are sometimes in small amounts that can inhibit that process without causing any further damage. So there's some examples here. One of the important antioxidants is vitamin E or tocopherol, which can trap free radicals and prevent that free radical damage in a cell membrane. And the wonderful thing about vitamin E is it can, when it's interacts with the free radical, that damaged vitamin E can be recycled and repaired by vitamin C. And in turn, the vitamin C, if it gets oxidized or damaged, can be recycled renewed by the thiol cycle. So the body has these wonderful mechanisms of recycling and antioxidants. Another way that the body can protect is through antioxidant defenses through enzymes. And we have a number of enzymes in the body that, such as superoxide dismutase, heme oxygenase, that can protect us from antioxidant damage. These we can't really get in the diet, but certain small molecules such as flavonoids or their metabolites actually show that they can increase the expression of some of these enzymes, which protect us in an indirect way. We've also shown that some flavonoids in apples, for example, can stimulate the production of nitric oxide through the enzyme that produces nitric oxide. So even though these compounds may be present in very small amounts, much smaller than vitamin C and vitamin E, they have a protective effect, but not through the same mechanism as what we generally call antioxidants. So what's the role of nutrition in protecting us from oxidative damage and free radicals? There's a few different areas. Jonathan mentioned some trace elements, and selenium and zinc, for example, are important in the structure and activity of antioxidant enzymes. So we need to get small amounts of those in our diet, which we should get if we eat the 2+5. The small molecules or bioactives that are derived directly from the diet, from fruit and vegetables, nuts and seeds, as Kathy gave you some examples. And of course, if we eat fruit and vegetables, we will be getting vitamin C and vitamin E, which do act as direct antioxidants. So the flavonoid bioactives, I think we probably shouldn't use the term antioxidants or antioxidant-rich food, because they don't really act in the same way as antioxidants, but they are bioactive. So I prefer to use the term bioactives. So the recommendations is to eat 2 fruits and 5 vegetables per day, and to get a wide variety of different types of fruit and vegetables in different colours. The question is, can we substitute that with a tablet? And I think that's a really interesting question, or a supplement. I think the advantage of eating fresh fruits and vegetables is that when you eat an apple, for example, you're not just getting some of these phytochemicals or flavonoids, You're also getting some vitamin C, a little bit of vitamin E, some minerals. You're getting fibre as well as some complex sugars. So you're getting a whole range of compounds that act together synergistically to provide a healthful outcome. Whether we can achieve that in a tablet or a supplement, I think, is a question we need to try and answer.
Do you have an opinion about juicing?
Sorry?
Do you have an opinion regarding juicing of the fruit and vegetables?
Yes, well, I think if you take the juice, try and get the whole juice, don't filter off the fibres and things, yeah.
With the whole fruit and
Yeah,
vegetables.
so fresh juice would be the same as eating the fresh fruit, I think.
What about cooking?
Cooking, a lot of the flavonoids are stable when cooked. So cooked apples with the skin, you're not destroying them. We're quite fortunate that even with storage as well.
As we're talking about that, apples in the store are often quite old. You can tell
Yeah.
when you get home, you go, crap. But are they, what's the content? Are they?
I think the best way is to get them fresh off the tree if you can, but that's not always possible. But the storing apples, for example, under the right conditions, studies that we have done in collaboration with people in agriculture at UW show that the flavonoids, at least, remain fairly stable during that storage period. So that way you can at least enjoy apples most of the year rather than just in season. Yeah. Yeah. Okay, thank you. I think to finish off, Jonathan is just going to talk about one of the new studies that we've got going in the Research Foundation at Royal Perth Hospital. Then we'll have time for, I think, further questions.
Thanks. I just like to briefly introduce a new study that we've been developing for about 18 months now, and it's just about to start this week. It's called the model study, which is modification of diet, exercise, and lifestyle. This study is aims to determine if an individual's knowledge of the presence of advanced blood vessel disease, and the presence of advanced blood vessel disease indicates future increased risk of heart disease and stroke, heart attack and stroke, whether that knowledge can increase physical activity and result in better management of cardiovascular disease risk factors.
So they want to know if what you say is actually sinking in. Is that right? Whether you're getting the message through.
Well, in this study, we provide the message. That is the early knowledge of an individual's risk. And in all chronic diseases, in cardiovascular disease, in cancer, in all chronic diseases, the earlier we know about if we're at elevated risk, the more that can be done to prevent in the future. And there's huge amounts of work, particularly in the cancer area, trying to identify, cancers very early on, because a huge amount can be done. And it's no different in cardiovascular disease. If we identify it early, 20, 30 years before, then a huge amount can be done to prevent it. So the method that we're using, or perhaps I should say there's been a number of advances in the last decade in imaging arteries to provide an indication of disease that's already present. Disease starts very early on in life, and then at some point it can be visualised using some of these techniques. So we're using measurement of advanced blood vessel disease using something called abdominal aortic calcification, which is strongly linked with increased risk of heart disease and stroke and death from any cause. And so the abdominal aorta is one of the largest arteries in the body, one of the first vessels where blood vessel disease can be imaged, and it runs parallel to the spine, and we can image that using various methods, such as CT scanning or X-ray. We're using DEXA, which is usually used to measure bone density, but you can take a scan using DEXA and image the artery. The healthy artery, here's the spine here, the healthy artery runs parallel, is not visible on that image. But if you get calcium being deposited, which is an indication of advanced disease, you get these little white dots along the artery, and that in this study will tell the people that you have evidence of advanced blood vessel disease in your abdominal aorta, and this is a warning sign of heart attack or stroke, and we hope that that information and then motivates them to change their lifestyle and improve their risk factor management. And the reason why we're using DEXA is that it has almost no radiation, very low radiation, very low cost. It can be used in just about anybody and be used repeated times over a person's life with almost no risk. Already there are over 400,000 DEXA scans being performed every year in Australia, so it can be rolled out fairly quickly. So the design of this study is it's a 12-week randomised controlled trial with looking at the question, does the knowledge of AAC itself lead to improved diet and lifestyle? We're then following everyone up for 2 years and looking at the question, does the presence of AAC, so some 50% of people will have evidence, 50% of people won't, does that lead to improved diet and lifestyle? Okay, so I'll leave it there.
So you're doing it right now?
It's just about to start.
Wow. So we have to come back in 2 years' time and find out.
It'll probably be a bit more than 2 years' time.